Hi, I'm Professor Mehmet Engin. Today's seminar title is Detecting Breast Cancer in Symptomatic and Asymptomatic Women by Thermal Imaging. Firstly, I would like to express that this seminar is based on the related original article and its purpose to evaluate the sensitivity and specificity of thermalytics, that is an artificial intelligence-based computer diagnostics CATS engine to detect breast malignancy by comparing the CATS output with the final diagnosis derived using standard screening modalities. Now, the outline of this seminar. The firstly, motivation and introduction, methods, including subtitles, thermalytics breast cancer screening, brief of study protocol, and results, including these titles: study data, performance of thermalytics, thermalytics compared with mammography, detection of malignant lesions less than 2 centimeters, comparing results across different thermal cameras, and finally, conclusions. Now, motivation and introduction. The incidence of breast cancer in women has been increasing over recent years. Approximately 2.1 million women were diagnosed with breast cancer in 2018, and more than 600,000 women died as a result. Screening mammography has been shown to reduce breast cancer mortality by approximately 20% in higher resource settings. However, mammography has low sensitivity in women with high breast density, and it is not scalable or economical in resources constrained environments. Breast ultrasonography (USG) is effective in symptomatic women and is used in adjunct mammography in patients in whom mammography is inconclusive, non-contributory, or contraindicated. Infrared or IR-based thermography has been considered for detecting early breast cancer in the past. Thermography involves analyzing heat patterns on the skin surface of this breast to determine focal thermal increase, asymmetry, and other thermal abnormalities. The vascular changes associated with malignancy, facilitated by the release of nitric oxide, lead to an increase in heat in vicinity of the malignant lesion and depict abnormal warm thermal patterns surround the lesion that can be captured using a high-resolution IR camera. However, conventional thermography involves manual interpretation of thermal images, which is complex and often results in erroneous results owing to subjectivity. Thermalytics is a computer-aided diagnostic engine intended to detect early-stage breast cancer with automated quantitative analysis of thermal images, eliminating the subjectivity in interpretation. In this article, it is evaluated the clinical efficacy of thermalytics. Now, in recent years, with the development of high-resolution thermal sensors coupled with computer-aided diagnostics analysis, IR breast thermography is again emerging as a modality for detecting breast cancer. To the best of the knowledge, no systematic clinical study has been published so far showing the efficacy of automated thermal interpretation compared with standard breast cancer screening modalities. In this article, it is proposed a new artificial intelligence IA-based CAD solution called thermalytics for automatic interpretation of thermal images using machine learning methods. It is presented multi-site clinical study evaluating thermalytics as a screening modality for breast cancer compared with currently accepted screening modalities. Now, methods. Thermalytix breast cancer screening. Thermalytix is computer-aided diagnostic software that uses artificial intelligence-based techniques to analyze and interpret breast thermal image to generate a breast health report automatically. A thermal image is a representation of temperature variations and the skin captured using a high-resolution IR camera. The thermalytics engine first determines area of high thermal activity from captured thermal images using relative temperatures thresholding to identify the hot spot and warm spots. In addition, high-resolution images it identifies cylindrical thermal patterns that represent vascular structures using a novel image processing techniques. These hot spots, warm spots, and vascular patterns are further analyzed to extract a set of features that are provided as an input to three pre-trained machine learning models to generate quantitative scores. These scores signify the probability of the malignant breast lesion. The thermalytics engine also generates a quantitative interpretation report with these scores and annotated thermal images with marking a hot spot indicating a malignant lesion and the vascularity network. Figure 1 shows the analyzed images with the lesion marking and vascularity respectively. Figure A denotes potential tumor boundaries marked with blue boundaries, and Figure B shows automatically extracted vessel regions with the blue boundaries and grayscale based. A sample thermalytics report is provided in the output of the classification system. The report includes three automatically generated quantitative scores, each of which are a real number between 0 and 1, indicating the probability of malignancy, with 0 being normal and 1 being the high change of malignancy. Following is a brief description of the three scores. Score 1. The thermobiological score, TS, is based on 34 thermal and symmetry features using information regarding boundary and shape of hot spots and warm spots, relative temperature differences, thermal symmetry between breast, and the presence and extent of the both hot spot and warm spot regions. Score 2. The areolar score, AS, describes the heat pattern around the areolar region and is derived by extracting 16 features characterizing hotspot regions near the nipple. Plus 1. Score 3. The vascular score, or VS, is based on 21 extracted features derived from the shape and temperature of the blood vessel structures, as well as the tortuosity of the vessels, relative increase in temperature, number of vessels, number of branches in the largest vessel, temperature deviation in the vessel, and symmetry of the vasculature between the breasts. Novel image processing and deep learning-based algorithm is used to determine the blood vessel structure from the thermal image to obtain vascular score from extracted vascular features. An overall thermalytic score is derived from the combination of these three scores, TS, AS, and VS, along with patient risk factors such as age, presence of symptoms, and last menstrual period using the support vector machines classifier. Now, brief of study protocol. A multi-site cross-sectional observational study to compare the clinical efficiency of thermalytics with standard of care was conducted on women more than 80 years of age at two sites, namely Healthcare Global, a reputed cancer hospital chain, and the Central Diagnostic Research Foundation, a diagnostic center, both in Bangalore, India. Thermalytics artificial intelligence engine to include images from all three different thermal camera models available in the current setting. The subsequent 470 participants were included in the prospective study. All study participants underwent the radiation-free automated thermalytics test, followed by mammography and/or ultrasonography test, which are interpreted by qualified radiologists, are were documented independently. Imaging for thermalytics was performed on-site by trained technician per protocol as described in detail. Thermal images of the participant captured in the 5 waves were uploaded to the thermalytics software. The thermalytics IA engine performed automated quantitative interpretation in real time and generated detailed thermal analysis report. The following definitions were used for positive test. First, thermalytic result was considered positive if the overall thermalytics CMV score was more than 0.5. Second one, mammography and ultrasonography. The results were scored by trained expert radiologists according to American College of Radiology Breast Imaging and Reporting Data System, BRADS. BRADS 4 and 5 were considered positive. Third one, fine needle aspiration cytology or FNAC and biopsy. Lesions detected as the positive for malignancy included both in situ and invasive cancers. All other benign findings were documented. Fourth one, disease positive. The final diagnosis of malignancy was decided by radiologists after reviewing the reports from the standard breast cancer screening modalities per clinical practice. A patient found positive for malignancy, breast 4 or 5 by mammography was further validated by the breast ultrasonography. If conventional ultrasonography was inconclusive, the radiologists used ultrasonography, elastography for confirmation. For women who underwent a biopsy or FNAC, the results of the biopsy or FNAC test was considered final diagnosis. Now, this is results section. Study data. A total of 470 women has satisfied the inclusion criteria and consented to the study were included in the data analysis. Of these, 127 women were less than 40 years age and 343 were more than 40 years of age. A study participant was categorized as symptomatic if she had a breast lump, breast pain, nipple discharge, nipple inversion, or skin changes in the breast. In the study population, 238 women were symptomatic, and the remaining 232 women were asymptomatic. Among the symptomatic women, 55% had a breast lump. Table 1 provides the distribution of different characteristics of the study population along with the cancer rate for two age groups. Yes, this is table 1. All 470 women were included in the analysis underwent the thermalytix test. Mammography was performed on 242 women and 458 women underwent ultrasonography. Of the 470 women, and 78 women were considered disease positive based on the final impressions of the expert radiologist using one or more of the available reports of the mammography, USG elastography, FNAC, and biopsy test. For women who were radiologically positive were found to be benign on full excision biopsy and were therefore considered disease negative. All biopsy-confirmed malignancies were invasive ductal carcinoma, except one, which was invasive lobular carcinoma. Now, performance of thermalytics. The overall sensitivity of thermalytics was found to be 91%. The specificity was 82%, although positive predictive value was 51.7%. Thermalytics showed a high negative predictive value of 97% approximately. Detailed sensitivity and specificity results of thermalytics for the symptomatic and asymptomatic populations are provided in Figure 2. Okay, this is Figure 2. It is interesting to note that thermalytics show 100% sensitivity in the asymptomatic population. Thermalytic results in the area under the curve, AUC, of 0.9 for all patients. Figure 3 result these output figures and table 2. Now, thermalytics compared with mammography. In the subset of study populations who underwent both thermalytics and mammography, the total number of subjects is 242. Thermalytics showed higher sensitivity compared with mammography, whereas mammography demonstrated higher specificity than thermalytics. However, because none of the thermalytics positive patients who were negative on mammography and ultrasonography had confirmatory magnetic resonance imaging, MRI or biopsy, final diagnosis of disease negative was biased toward mammography. In the asymptomatic group who underwent both tests, total number of is 95 patients. 4 cancers were detected, and thermalytics demonstrated superior sensitivity compared with mammography. This is consistent with other studies, which also found missed cancers during routine screening mammography. Among the 470 women in the study population, mammography scans were not recommended for 228 women because of dense breast, younger age, or other clinical reasons as decided by radiologists. In this subset of the women, thermalytics showed a high sensitivity and specificity, respectively. Thermalytics detected 19 or 21 patients diagnosed as having malignancy in the subset of patients who did not undergo mammography. Further, 11 women who were less than 40 years of age were found to have a malignancy, and all of the 11 participants were detected by thermalytics. Now, detection of malignant lesions less than 2 centimeters. One of the concerns of manual interpretation of thermal images is difficulty in detecting of deep tumors because the metabolic activity of small tumors may not transfer to breast surface to appear as a hotspot. However, automated artificial-based analysis in thermalytics uses vascularity to complement hotspot detection and can analyze abnormal warm areas and hence is capable of detecting small lesions. In this study, 24 malignant tumors were less than 2 centimeters, or T1 tumors, and thermalytics correctly identified 17 of these as positive. Mammography, however, showed low sensitivity in detecting T1 malignancies. For tumor more than 2 centimeters, sensitivity of thermalytics was 94% approximately, and that of mammography was 93% approximately. Now, comparing results across different thermal cameras. Respect to Food and Drug Administration clinical guidelines to test generalizability of thermalytics across imaging hardware. Study involved the use of the 3 different models of thermal cameras with different thermal resolution. One of the 470 women in the study, 56 women were captured using an fuller T650SC camera. 226 women were captured using filler A315 model camera, and the remaining 188 women were captured using a midi-term camera. These were captured by 3 different technicians at the 2 study sites. Table 3 lists or denotes the results for each model of thermal camera. This is table 3. High resolution and high sensitivity cameras seems to be introduce more noise in data. Table 3 lists summary of these results. Now, in conclusions, thermalytics show high sensitivity for breast cancer detection in both symptomatic and asymptomatic women. Furthermore, thermalytics detected 2 more cancers than mammography in asymptomatic women less than 40 years of age, showing its complementarity to screening mammography. Thermalytics artificial intelligence software can reduce the need for highly skilled imaging technicians, thus making it more affordable for emerging market countries. A large-scale study needs to be conducted to evaluate the potential role of the thermalytics as a standard of care breast cancer screening modality. Overall, it is believed that thermalytics with its automated scoring, annotations of potential malignant lesions, and high accuracy or interpretations is posed to be promising modality for breast cancer screening. Thank you. See you again. Bye.